And, not a lot of people end up translating that into later work. A lot of people get into organizing and then, they enter the private sector or they get they do whatever. But you kind of stayed in the community.
Yeah, I did spend some time at Kaiser Permanente, which was a fantastic role for me. It was government relations, community relations, and
Kaiser's pretty cool.
Yeah, I learned a lot about healthcare. I went during the time when the Affordable Care Act was being debated.
That must have been foundational.
Well, yeah, when I was working in the legislature, I was staffing many different policy issues, and you don't really get to dive deep into any when you're in the field office. So when I was at Kaiser, I got to just know a whole lot about health insurance and health care and how hospitals work. So when I came here to Latinas Contra Cancer almost 8 years ago, I was able to bring that background of organizing and public policy work and politics.
I want to see the look on Kaiser's face when you took all that experience and went through Latinas Contra Cancer.
Oh no, they were supportive.
That's great.
Yeah, they were really helpful. The folks at Kaiser have been really, really supportive of our work, and I learned a lot about justice there too.
Then they had a smile on their faces.
Yeah, yeah, they've been really supportive. Some good folks over there. One of the reasons I wanted to come to the nonprofit sector, this is my first job ever in the nonprofit sector actually. One, my grandmother passed away of breast cancer, and she was in the first support group ever held by this organization 27 years ago. So I did feel like it was a little bit of honoring,
Your grandmother.
But
rest in peace to her.
Yes, thank you. In breast cancer awareness month, she passed away of breast cancer. But I remember as a younger person, was very close with my grandmother, who was an orchard worker and a cannery worker, that this organization provided so much dignity. And so when I came here to LCC, the word that just kept coming up for me was dignity. How do I make sure that our organization is fighting for the dignity of all people? The healthcare system in so many places fails people. In so many places it doesn't treat people with dignity. And in many, many places it's just not set up to do that. It's not that it's, broken. It's
But then you have power in numbers and then your organization comes in.
Yeah, I was always curious, particularly when I was at Kaiser, I used to have these thoughts around what would happen if a bunch of patients decided that they were going to just not leave our lobby until one of them got the care that they needed. I was always really fascinated because I'm an organizer, right? It doesn't go away, it stays there.
Social experiment.
Right.
Yeah.
I was always just wondering, what would happen if a bunch of patients just and did it for maybe just someone's care? And that would always just really fascinate me to think about. So when I came here, it seemed like the right place to think about patient organizing and how do we build a patient organizing movement where patients
a place where thinking things like that isn't so foreign.
Right. Well, I think there should be organized patients wherever healthcare is delivered. Wherever healthcare is delivered, patients should have power. They should be organized. They should be able to make demands. They should be able to bring consequences, right, for not doing right by patients. And we have to.
That's why we have the medical boards.
Yeah, that's one way. Yeah, one way.
One way. You know more about it.
One way. But sometimes it doesn't even necessarily need to rise to the occasion of malpractice. Sometimes it can just be
having conversations.
Yeah, having conversations, or it can be we looking at resource distribution within hospital systems, or where hospitals are built, or how they're built. And what type of
See, I went straight to malpractice, and you went to there's all these other avenues.
No, that's one space, right? Yeah. That's one space for sure, and definitely there are organized patients there, and there are trial attorneys and different folks who work on that. But healthcare should belong to the people. In all aspects of it, not just when something's going wrong or when someone has been wronged or something rises to the level of medical malpractice, but hospitals can be co-governed. They can be deeply in community. They can be, and regardless of who owns them or what payer system they have. I envision a day or dream of a day where we think about our hospitals and our clinics the same way we think about libraries and schools or parks, right? That we have some public ownership over them. So I know there are many clinic systems that are thinking that way too.
Definitely.
But, our healthcare system, really
and it's because of folks like you.
Lead the charge.
Yeah.